Men in their late 50s and 60s who come in with concerns about sexual performance often say the same thing early in the conversation. I suppose it's just my age, and by the time they've said it, they've usually half decided not to pursue it further. Age becomes both the explanation and the reason not to look more closely. I want to examine that assumption, because the distinction between what aging genuinely causes and what it gets blamed for is worth making clearly. There are real, normal changes in sexual function that come with age: longer arousal time, erections that require more direct stimulation than they did 20 years ago, a longer refractory period, slightly reduced firmness at peak. These are physiological shifts, not dysfunction. They're worth understanding and adapting to, not treating. But a significant proportion of what men attribute to age is actually driven by specific factors that have accumulated alongside the years. Vascular health, blood pressure, cholesterol, cardiovascular fitness, body weight has a direct, documented relationship with erectile function. Sexual performance is fundamentally circulatory. The same processes that affect heart health over decades affect the small blood vessels responsible for erection, often earlier than they affect larger vessels. That's not fate. It's vascular biology. And it means these factors are addressable, not just the inevitable price of aging. Testosterone decline is real, but often overstated. Free testosterone falls by roughly 1 to 2% per year from the mid-30s, and around 20% of men over 60 have levels below the normal range. But gradual decline without symptoms isn't the same as clinical deficiency that warrants treatment. Symptomatic decline with confirmed low levels is a different picture, one worth assessing rather than assuming. Sleep is worth mentioning specifically. The majority of testosterone production happens during deep sleep. Poor sleep quality, which becomes more common in men over 50, suppresses testosterone production nightly. Sleep apnea is significantly underdiagnosed in this age group and is a frequently overlooked contributor to fatigue, reduced libido, and sexual difficulty. For men going through significant life transitions, a divorce, a period of absence from intimacy, re-entering the dating world, the psychological dimension matters too. Confidence and performance aren't fully separate systems. Anxiety about performance creates the nervous system response that is physiologically incompatible with erection. Naming that clearly tends to help more than medication does in the short term. The honest answer to the question, is this just age? Is usually, some of it is, and some of it isn't. An assessment that looks at the full picture gives you a clearer answer than any general guide can. If you'd like to understand which side of that line your situation falls on, a free informal chat is the starting point. No commitment required. The link is below.